It's my pleasure as Chairman of the Orange County Board of Supervisors to welcome all of you to the OC press conference at the site of our next Be Well Orange County campus. I'm joined today by my colleague, Vice Chairman Don Wagner, and our partners, Congressman Lou Correa and Congresswoman Young Kim. Since I began my tenure on the board, I worked to foster collaborative relationships across all levels of government, help us support the many great programs and initiatives the county has underway. I'm grateful that Congressman Correa and Congresswoman Kim have built strong relationships with us in the county. They've met with us to understand our needs, and recently they secured community project funding requests on behalf of the county to help us meet our program goals. Thank you to Congressman Correa for securing $5 million towards our Coordinated Reentry Center. And thank you to Congresswoman Young Kim for securing $2 million towards our Be Well Orange County Irvine campus, which is to be built here. The Coordinated Reentry Center is a core project under the reentry pillar, what we call Orange County Cares. That's actually the fourth pillar of our criminal justice system reform that we're initiating. The first pillar is a prevention pillar, keeping people out of the system entirely. The next is where we do have an in-court encounter, but we're still looking to keep them out of the system. And the next is where we actually have an in-custody situation where we try to provide services that are helpful to the needs of those in the in-custody system. The fourth is what we call the reentry pillar. We try to continue the services that they found useful to them. If upon release we find they're homeless, through that reentry system we try to find them a place to stay. If they have other services they need, we try to provide that so that can be continued so they don't come back again into the justice system. So the services are very important because that's how we eliminate what we call recidivism. Our expansive systems of services also includes another center here, which is called Be Well Orange County. Be Well Orange County was founded as another collaborative public-private partnership between the county, CalOptima, and many of our hospital systems. Our Be Well initiative, Orange County, leads the way because it provides individuals facing with mental health challenges and or substance use disorder, substances all under one roof. The Be Well Orange County campus will focus on the mental health and wellness needs of families and children in the entire Orange County community. A month ago, our Be Well Orange County campus received national recognition. After hearing about our Be Well system, United States Health and Human Services Secretary Xavier Becerra stopped in Orange County as part of his national tour to improve mental health services. After touring the facility and learning about our system, he hoped that the Be Well system can serve as a model for mental health care in the entire nation. He'd not seen a system that was nearly as good as what we had provided. Indeed, we do have a model for the entire country. Now, I'd like to invite my colleague, Vice Chairman Wagner, up for make whatever remarks he would choose to make.
Let's say whatever comes to his brain. All right. First of all, thank you all for being out here. This is my district. It is a pleasure to host you all here, and more importantly, to host the next Be Well campus as we move forward with that. And I also especially want to welcome our two great partners at the federal level, Congresswoman Young Kim and Congressman Lou Correa. The truth of this program was outlined by Chairman Chafee in terms of the recognition that it's gotten at the state and the national level, the fantastic work that is being done. The goal here is to provide resources that will help individuals who are in the justice system or are otherwise experiencing the kinds of mental health and abuse problems and substance abuse issues that don't respond as well to incarceration, that in fact allow folks to come out and have an opportunity to get back to a productive life, which is something that we all encourage, and with this facility really are intending to take to the entire Orange County community. We've got one of these facilities already in the Orange area, which was my district when we opened it up. It no longer is, but it doesn't matter. It's a facility that is available for the community, and we are now broadening the reach. We're doing it on an absolutely bipartisan basis. It is so wonderful to have two stalwart champions of Orange County working on our behalf in Washington, D.C. to bring to this county the resources that we so desperately need, and that with our partners Mind OC and Be Well, with our partners in the Sheriff's Department, we're proving we know how to use, to spend, to help people who need, and deserve, and want the help. So thank you to Congresswoman Kim and Congressman Correa for joining with us on this important effort. And without further ado, let me bring up to speak to you one of those champions for Orange County and the constituents we share, Congresswoman Young Kim.
Well, ladies and gentlemen, thank you for being here. I am really excited to be here today with Chairman Doug Chafee, Vice Chairman, my former colleague in the Sacramento legislature, Don Wagner, my colleague and partner in crime in Washington, D.C., Congressman Lou Correa, and also Sheriff Don Barnes, who is doing a tremendous job keeping our communities and businesses safe here in Orange County. And I'm really also happy to be here with the Orange County Healthcare Agency and Be Well OC as we come together to celebrate the success of OC Be Well, and look forward to what more is to come right here in Irvine. As we all know, the pandemic has hit us really hard. But as we continue to protect public safety and as we reopen our communities, we know very well that we need all hands on deck to address the health and wellness of our communities, and that requires collaboration between services and industries and all of us coming together to work in that regard. And this is especially true when it comes to the mental health, caring for our children, our families, and our neighbors. The COVID-19 pandemic really showed us that mental health is really critically important health area, and now more than ever, we must come together to meet the mental health needs of our community. Fortunately, Orange County is quickly becoming a model of how a community unites to ensure the optimal mental health and wellness for all. So when we work together with an intentional, coordinated public-private partnership approach, the community will benefit from quality services within a system that patients can easily navigate. So I came to Congress, or when I went to Congress, I promised that I will deliver results for our community. And this is part of keeping that promise. And I'm really excited that I was able to request additional funds and supplement what my colleague, Congressman Lou Correa, has done. So his $5 million, our office securing additional $2 million. This funding will allow Be Well OC to continue and expand its vital services and the important work throughout our Orange County communities and through this Irvine Center. So I'm really excited to be able to see what more we can do together collectively to help those in need, especially in the mental health areas. And I want to thank everyone who is affiliated with Be Well OC and all the partners in the healthcare agency, but more importantly, our Sheriff Department and everyone else to keep us safe. We got more work to do, but this is just the beginning. Happy to be here. Thank you. I am delighted. We talk about working in a bipartisan way. When I went to Congress, one of my best buddies, who sits on the other side of the aisle, is Congressman Lou Correa. And I make it a point every time I enter the House floor to go through the entrance where I have no choice but to go through my Democratic colleagues. And he's always there greeting me with an open arms and with a big smile. Pleasure to work with Lou.
Ms. Kim, just remember also that I hang out on your side of the aisle quite a bit. I know. And that's where we get most of our work done. Mr. Supervisor, Mr. Chairman Chafee, Doug Chairman Wagner, Ms. Kim, our sheriff, and members of the audience, first of all, I want to thank all of you for being here today. These issues that we have in front of us that my colleagues have talked about, mental health, drug abuse, homelessness, we're trying to fix them in Washington, D.C. We really are. Colleagues from across the country sitting down both sides of the aisle trying to figure out how to fix these problems. I propose to all of you that the real solution is where the rubber meets the road. County governments. You're here providing medical services, mental services, public safety services, and you live this day in and day out. And that's why I'm so proud to be here today with you, because my colleague, Ms. Young Kim, myself, and others have essentially responded to your ask, your request for funds to come up with some creative, innovative solutions here in Orange County. I remember when I was in the state legislature, I used to brag to my colleagues in Sacramento of all the innovative things we were doing in Orange County, and they would look at me and say, really? This is one of those really moments that with the leadership of the county officials, Sheriff Barnes, all of you here, we're coming up with the real solutions that we need to face the problems that are getting worse and worse in our society. How many of us go home in our neighborhoods and see a mentally ill individual, homeless individual? Your heart goes out to them because you know that person is somebody's daughter or son, and something went terribly wrong in their life, and they have fallen through the cracks. I often stop and say, but for the grace of God, there go I or a loved one that I may have. Painful stuff. And the old way of doing things, which is public safety one solution, is not working, hasn't worked. And it's time to approach this comprehensively. Mental health, medical health, counseling. Speaking to some of our friends earlier today, wouldn't it be great when the Sheriff Barnes gets a phone call, maybe instead of an officer going out, there's a couple of social workers that go out to see what happened, to get things under control before they get any worse. This is what Orange County is all about, trying to figure out how to make it work better for all of our constituents here in Orange County. Ms. Kim, I'm proud of the good work we're doing, proud of you for teaming up with us to make this happen. Like I said, the real solutions are here in Orange County where the rubber meets the road. And I'm looking forward to continuing to work with you, learn from you, so that we can be stronger advocates for the resources you need to make the lives of our constituents much better. Thank you very much.
I'd like to thank Congresswoman Young Kim and Congressman Lou Correa for being true champions for us in Orange County. And we'd like to extend an invitation for you to visit our projects, the ones you funded especially, but others may have, whenever you like. It wouldn't hurt if when you came you brought a little more money with you. And I'd like to thank, well, you do work across the aisle, so whatever that can bring, we're very grateful. So thank you. And although he's not present, I do want to thank and recognize my board colleague, Supervisor Andrew Doe, for his contributions toward these programs in leading us to improve coordinated reentry and mental health services in Orange County. Among all my colleagues, he has been the driver of those programs. I'd like to thank all you for joining us here today. And at this time, if there are any questions, we'll take them now. We do have people in the audience, such as our sheriff, who can answer some questions.
Members of the media, if there are any questions at this time, you may ask so at this microphone.
The Supervisor, Chairman Chafee, and others in the room, I've opened this question to everyone involved in this whole connection of healthcare management, this new approach to healthcare management in Orange County. We call generally wrapped up into what the governor calls care courts. All of these organizations are involved in one way or another with the governor's idea of a care court. How far along and to what extent have county plans been integrated into the care court concept that the governor is now rolling out?
Well, actually, we've been working on that concept now for several years. We call it OC Cares, in which we have actually established a collaborative court system where some of these services are integrated into our court system already. We're looking to create a better facility so we can do more of that. And we've been looking at the ability to come out of our silos, not just the things that the governor is talking about. We add to it things like probation, like our health care, like our social services. Even now, Orange County CalOptima can be involved in some of these things. And of course, our sheriff services are critical. We've been involving the courts in that as well. So although we call it OC Cares and the governor calls it something else, we're already ahead of that. And we're hoping to roll this out more by the end of the year. They're even integrating it into the communities because we want community partners to help with the services that we need to bring the care that we need into the people that are involved. That's not only the mental health services, but the ones that have substance use disorders, and try to make that better for them. We don't want them to have these problems because they do affect others, especially their families. And if they are in a criminal justice system, we want them to come out and not come back. So,
Mr. Chairman, if I can add a couple
yes,
comments.
please.
When I was in the state legislature a lifetime ago, there was proposed state legislation moving to create the statewide collaborative courts, community courts. And I asked for one amendment only, and that is the Orange County courts be exempted from that legislation because we were already doing it the right way. And I just wanted to make sure they didn't come in with proposed legislation with the best intentions and disrupt what was already working very well in Orange County. So to the chairman's comments, we've been doing this. Orange County has stepped up and has done many innovative projects, and we want to make sure Orange County continues to lead the way. Thank you.
Well, we want to expand our collaborative court system, among other things that we're doing. So we'd welcome any funding that the state has to help us do that. It's in sync with what the governor is intending. We're actually a little ahead of that, though, but some money would be helpful.
Are there any other questions from members of the media at this time?
Just a follow-up for Sheriff Barnes. To what extent, Sheriff, is the Behavioral Health Bureau integrated into this Be Well operation that now delivers many homeless from the street to its current location on Anita Drive, and at some point in the future, this location as well. Is the Behavioral Health Bureau part of that integrated delivery system?
So yes, I have 40 deputies that do full-time Behavioral Health Bureau in the communities we serve. I also have an equal number of deputies assigned to our custodial facilities, our jails, who work within our facilities on Be Well. What I love most about the funding that's brought forth, which is part of the continued build-out from the Board of Supervisors with CEO Frank Kim and his staff, healthcare and others, this is really just another iteration of the years of very intentional efforts that this county has taken on. I love the Be Well campus because it's pre-custody focused, people in crisis, and I love the reentry because it's post-custody sustained success focused, people transitioning through our jails, help keep them into sobriety or stability or into housing or employment or whatever that might be. But our Behavioral Bureau, to put this into numbers, just in the first year of the Anita Street Be Well campus in Orange, our deputies diverted over 400 people to that location for services rather than taking them into custody into our jails. And it's my understanding with Marshall Moncrief, who's here, who's the executive director of Be Well, and Dr. Rick Afable is here, is also very supportive in many efforts in homeless outreach efforts and diversion efforts as well, that the vast majority of these people who are going there are receive services that are necessary, get them into stability or sobriety, and the vast majority of them leave with sustained success. And what that means to me personally gets us out of the business of, it's breaking that cycle of incarceration. It's actually preventing incarceration for some of these people in the first place, which is what we hope to accomplish for people that will receive services, want to buy into their own treatment, looking for options, and really off-ramp people, in my perfect world, off-ramp them into services long before they even have a law enforcement contact. If we can create a system where that occurs, we all win. And I think especially on the re-entry component, when we get people traveling through, we're building a facility, 384 beds, focused on re-entry programming to get people into stability before they get released, connected to services, saturate them with service offerings, and then tie them off to this warm handoff with this post-custody re-entry facility that will come online, will help them maintain that stability once they get released as well. Again, with the ultimate goal of breaking the cycle of incarceration. Did I answer your question? Thank you.
Thank you, Sheriff. I might add that the thing that Sheriff was talking about is called a sobriety center, where not only the sheriff but other policing agencies can bring people that they found that are either have a alcohol or other drug use issue. Then they can, if I may bottom line it for you, sober up in a sobering center instead of a jail. And that's kind of what we do. And after they sober up, we work on behavioral changes. It's been very successful in doing that. And the officers involved, when I've chatted with them, relieves them of paperwork. They don't even have to open a file in some of these cities. They drop them off. They can drop off faster at our sobering center. They could book them into a jail. Well, it has been incredibly successful in doing that. I might also add there's some other homeless components that we're working on, such as our street medicine initiative, where our social services agency and our Orange County Health Agency and CalOptum are joining together to provide street medicine to our homeless people, going out and finding them where they are, seeing what their needs are, and trying to help them rather than them sort of coming to a center or going without. So there are many things that we're doing here that we think are not novel, but at least cutting edge, and they're being a great help as we can to the population that need the service. Do we have any other questions? No. Well, thank you all for coming. Appreciate your attendance here today, and thank you for the questions that you asked. And I hope that we are here together, and that you're just seeing us together, but not seeing the work we do together, because that's ongoing all the time. And I appreciate all the people who come here today and the tremendous service that they provide. So again, thank you for our press conference, and particularly thankful for our people who, I don't know if you had a red eye coming here, but thank you to Congresswoman Young Kim and Congressman Lou Correa. Again, you're welcome here anytime, with or without more money. You're welcome.